personal reason for choosing research in hemorrhage control comes out of my earliest experience as a vascular surgeon when I was deployed overseas, and my partners who I worked with closely evaluated the reason why people ended up dying in the field. It was because of bleeding to death. So I have a specific interest in devices that might be used in a minimally invasive fashion to control hemorrhage. The goal is to bring something we can utilize in a trauma center, in a military forward location, or even with emergency medicine personnel to limit bleeding early so that definitive control of the bleeding can occur. So my specific focus has been on a balloon catheter to put into the aorta through the groin artery. So while that balloon's inflated, it shunts all the blood to the vital organs. That term is called REBOA, resuscitative endovascular balloon occlusion of the aorta. I think one of the more important discoveries that we made is that if that balloon is left up too long and not let down to let blood flow back to the lower extremities and to some of the contributing arteries to the spinal cord, it actually is very harmful for the spinal cord, and that can leave someone at risk for paralysis. The other focus of my laboratory research is really on the development of aortic aneurysms. I've often been puzzled by the question of why cigarette smoke is such a trigger for aortic aneurysms. Millions of people have a smoking history, but a small subset have aneurysms. But of the people that have aortic aneurysms, 80% have smoked. So that trigger really links closely to whatever genetic predisposition people have to aneurysms. So I studied the influence of inhaled tobacco products and how they're linked to aortic pathology. But they definitely do influence vascular biology heavily. I think innovation is really important. Vascular surgery, dealing with blood vessels all over the body, has a unique position to study these things in the lab, to link innovation with laboratory research, to bring things forward so we can bring those to the patients.